Hi, I'm Dr. Tim Lynn, and we're going to answer some questions that I receive almost on a regular basis about thyroid. Okay, the first one that I commonly hear is, I'm taking thyroid medication. How come I still have the thyroid symptoms? Well, that's a really common question, and a really good question too. To answer that, it could be a lengthy answer, but I'm going to try to streamline it here. First of all, there's 7 different patterns of thyroid malfunction. Only one will respond to thyroid medication, and that's primary hypothyroidism. So if someone is diagnosed with primary hypothyroid, and it's truly the case, they will take thyroid medication, whether it be Synthroid, levothyroxine, Armour, Cytomel, whatever medication, either synthetic or naturally, and all their symptoms go away. They feel better. They start losing weight. They get their energy back. They're no longer fatigued. They're sleeping better. Their skin is not dry. All the symptoms do go away. That's primary hypothyroid. If they do not have primary hypothyroidism, they can be on medication and they're not going to get better. The symptoms are not going to go away. So to answer that question, if your symptoms are not going away, you are one of the 6 other patterns, not primary hypothyroidism. Okay? Next question I hear a lot is, why am I so tired all of the time? This is a really good question. So many people are fatigued all the time. And this is a little bit more complex because here's what people normally do. They'll start drinking more coffee, or they'll go to the health food store. They'll go, what can rev my motor a little bit harder so I can kind of have the energy to get through the day? Why am I crashing at 3 o'clock in the afternoon? I'd eat a nap. There are a lot of different things that can cause that to happen. And the primary thing you need to look at is why this person's unhealthy in the first place. If that's happening to you, if you have chronic fatigue, and especially with other symptoms as well, you need to investigate why that's happening. There are many different things that can cause that to happen. Thyroid condition can cause that. Abnormal blood sugars can cause that. Hidden infections can cause that. I saw that just the other day in here, and that was his primary symptom, was, I'm just really fatigued. And we found like 3 or 4 things that can cause that. Anemias can cause that. Overstressed adrenal glands can cause that. So we can go on and on and on, and it can be either one of those, a majority of one, or it can be a combination of all of them. So you need to investigate and look to find out what the primary cause is for that specific individual. The next question I'll answer here is, what makes their treatments different than what I've already tried? Another good question. And to answer that, I can't specifically answer that because everybody's individual. We treat the person individually here. I can have 10 thyroid patients with identical symptoms, and they may get 10 different treatments, either metabolically and neurologically. Metabolically is maintaining and restoring the normal physiology of what's working on the inside. Neurologically is using some functional neurology to balance their brain, or get their brain functioning better. A lot of people have brain fog due to massive neuroinflammation, so that needs to be removed. So can I answer that specifically? No, I can't, because everybody's individually. Everybody gets an individual care plan that's going to benefit them the most. Next question, how long will it take for me to get better? Good question. Here's the answer. I don't know. Some people can start seeing changes in a few short days. They start noticing some significant changes. Other people, it takes, a few months for them to start, really noticing a significant difference. And once again, that depends on a lot of different factors. 1, severity of the condition. 2, how long someone's had a thyroid condition. There are just a lot of different factors going on with that. So most people, here's a standard what I normally see. Most people are a minimum of 30% better within a few months. Okay, that's what I normally see. Most people are faster than that, but some people, make that average about that. The last question I'll answer today is, how come I'm not losing weight when I'm eating right and exercising correctly? Once again, I'll use a one-word answer to this question. The primary answer to this question is inflammation. There is inflammation in your body. If you have inflammation in the body, you will not lose weight, period. Consulted with another lady just the last week. She is exercising 4 hours a day, and she's not losing any weight. And you should lose weight if you're exercising 4 hours, 5 days a week. Actually, 6 days a week in her case. you need to find where the inflammation is coming from. You need to remove the source. Once again, that can be a lot of different mechanisms. It can be a lot of different places. The problem people have is they'll go, well, this is where it's coming from. They'll look at one place only and they go, I tried that, that didn't work. You need to investigate all. That's kind of what we do here. As I get more questions, I will be answering them and put them in on video so more people can get the answers that I have for them. Thank you.